Good morning, and thank you very much for that kind introduction. Let me thank all of you for being here, engaging in the political process, but more importantly for being in Sacramento. Thank you, and give yourselves a round of applause for that. I also want to thank the San Joaquin Valley Health Fund and, of course, Equity in the Mall. I want to talk to you about values. I want to talk to you about dreams, but more about social justice, especially when we're going to talk about healthcare. My grandfather came to this country with a third-grade education from Mexico. He did find his way through the Central Valley. He toiled in the fields for a while, but ended up in Los Angeles, where the first job that he got there was working with his hands in construction. Fast forward, he was able to afford a home, and then my parents were the first in their family to graduate from high school. And my dad worked in a factory his entire life. But here's the dreams of my parents, like the dreams of many of your parents, many of you as well. They wanted me to go to college, to be the first in my family to live that American dream, to be able to succeed. And I was. I not only was the first in my family to attend college, but I was lucky enough to get a full scholarship and became an eye doctor. And I returned to my community. And eventually I'm going to talk about how our communities share a lot in common, and the trips that I've done to the San Joaquin Valley and the concerns that I have, especially when it comes to healthcare. So when I graduated, all I wanted to do was to open a practice in my community, a predominantly Latino, working class, poor community, provide healthcare like your champion in the San Joaquin Valley, Joaquin Arambula, did, and I wanted to make a difference. But I was frustrated. I was angry because of the broken healthcare system that we had. Let me tell you the type of healthcare system we have, because now I want to talk to you about social justice. We have a two-tiered healthcare system in this country. We have one for wealthy people who can afford healthcare, and one for poor people who don't have access to healthcare. That's a social justice issue here in this country. And that's what prompted me to get angry and run for office. Do you realize that we have specialists and physicians that go to wealthy communities, but guess where they don't go to? They don't go to the communities like Tony Thurman comes from, Oakland. They don't go to La Puente, California, and they don't go to the Central Valley. They don't go there. To me, that is a travesty. That's why I applaud Joaquin Arambula for going back to his community. So I ran for office out of anger. But I'll tell you, it has been the absolute most rewarding thing that I've done in my life, because I've been the champion to be able to implement the Affordable Care Act, but more importantly, to fight for the things that are important to make sure that those communities that have the least have the ability to have access. I'm going to give you an example. When, after this last election, Senator De Leon was talking about what happened with this most recent administration, and I was petrified that the repeal and the replace was going to occur. To the San Joaquin Valley, we held a hearing in Bakersfield a year ago, I believe, last month or this month. We were there to hear from the people in the valley, more importantly, what it was not to have health insurance, then what it was to have health insurance, these compelling stories, and then what it was, the fear in their eyes needed the most, that had the highest number of Medi-Cal patients in the heart of the San Joaquin Valley. And luckily, there was no repeal and replace. But let me also tell you the things that I've done that have really angered me. I've taken several trips to the San Joaquin Valley. I visited East Orosi, Alpa, Elenair. And guess what I found there? We have families. I met with a woman who I sat at her dinner table who has to pay for water that comes into her home that is contaminated. And she not only has to pay for that water, but she has to pay for the water that she drinks, that comes to her house in the form of bottled water. This is third world circumstances that we have in the United States of America and the state of California. This is unheard of. We should be yelling from the mountaintop because no other country would allow their citizens to have unsafe, contaminated drinking water. And guess where it is? It's in the San Joaquin Valley. So these are the issues that we share together. The community that I came from, the community that you live in, but more importantly, the values and the issues that we have to fight for to make sure that everybody in this country have access to affordable health care, clean drinking water, clean air, and the dignity that they are going to be able to have to live in a community that they feel safe in. And this is why I think we have so much in common. So I'm just going to close with this by thanking you for allowing me to spend some time with you this morning. And I'm going to give a challenge to you. I want you to become angry and become activists. And I want somebody out there who's going to run for office to make a difference in your community and stay in your community and make sure that you become politically active. Anyway, thank you very much for having me. Have a great morning.